joint preservation is the word which we normally use across the timelines, across the age groups. So if you look from adolescence, childhood, adulthood, aging adults, and then old age. These are the various stages of life where there are certain changes happening to the joints as we have activity, you have sports, you have fitness activities, and sometimes you have injury in between. So currently we will focus only on the joint injuries and we are dealing with the knee today. So in knee, when you have an acute trauma, either a vehicular accident or a sports injury like a football, volleyball, or basketball, or sometimes in badminton, table tennis. So, whenever there is an injury, there will be some forces acting on the joint when you are in a weight bearing position. Supposing if you fall from a stool or you are on a two-wheeler where it slips, or you are just tackled by a footballer from the outer side of the knee. So various type of patterns of injuries can happen. So in the knee joint, the two major important ligaments, two on the sides, which is one medial collateral, a lateral collateral on the side, and two in the center of the joint. One in the front is known as ACL and the one in the back is known as PCL, anterior cruciate ligament and posterior cruciate. They are cruciate ligaments. So basically, these are the important structures stability wise, plus most important another part of the joint which contributes to stability, joint protection, is the meniscus. So common pattern of injuries in the knee in a case of sports injury or two-wheeler or domestic falls are either meniscus or ligament injuries or in combination. Very severe injuries sometimes have a knee dislocation or subluxation, but we are basically not dealing with it right now. So in stable type of injuries, when the patient after 2 or 3 days or the same day of the injury comes to you who is walking without any support or aid, probably you are dealing with an injury which is a low velocity and relatively stable injuries. So there are situations in the knee injury where you may opt to treat the injuries non-surgically. Usual clinical assessment, you will grossly know what structures are involved, whether collateral is injured, ACL is injured, PCL is injured, and accordingly you will support the joint in various positions. Like if when you have a PCL injury, we try to protect the posterior sag of the joint in order to keep the joint aligned. In ACL injuries, there are at least 70% of the injuries which are in a pattern where you can treat them non-surgically. And for that, apart from a clinical examination, and if the joint is stable on the sides, then a proper sequence of MRIs will guide you about the displacement of the ACL tear fibers and the gap between the torn fibers. And there are certain criteria which we follow, and if the patient and its pattern of injury is within that time frame and plus the type of changes what you see on MRI, then a cross brace type of treatment what we have started doing since last 2-3 years, that keeps the joint in a 90 degree of flexion and it promotes apposition of the torn ligaments. So like any injury in orthopedic, if you align and rest it, it is supposed to heal like a bone also heals if it is aligned and rested. So similarly, the ligament also can heal, but it needs a proper positioning and fixation of that cross brace in a particular fashion for up to 3 to 6 weeks depending upon the type of injury. So there are stable injuries or there are injuries which are amenable to non-surgical treatment, and most of the time surgeons or clinicians, they feel that any ACL tear or meniscus tear will require surgery. It is not like that. And when we need to operate, there are patients who have a severe disruption of the ligament which is out of its sheath. It is displaced out of the intercondylar notch as we call it. There are meniscal tears which are flap tears, which are bucket handle type of tears, which are blocking the tibia and femoral movement, tibiofemoral movement. So they are unstable tears or complex tears which will need surgery at some point of time. So in any given situation, our time to the surgery is basically dependent upon the type of unstable injuries. If there is a grossly displaced meniscus tear, there is no point in waiting. You have to operate this patient. And usually when you have a displaced bucket handle tear with an ACL tear, then usually we treat and repair everything together. If there is an isolated ACL tear with a stable meniscus tear. Usually, we allow the joint to settle down, we brace it in extension, then start the rehab after 2-3 weeks by the time capsule and collateral heals, and then usually by 6 to 8 weeks, when the joint is in good shape, reaction is gone, swelling is gone, patient is nearly having full range of motion, then only we operate the patient for the reconstruction or repair.